Okay, so I think it's a good numbers to start, Arijit, because we don't
Sure,
want to keep everyone waiting.
ma'am.
Um, so this is Nilanjana Maulik, the Secretary of the Alzheimer's and Related Disorder Society of India, Calcutta chapter. Those of you who do not know me, um, that was the introduction for all of you. Once again, we are back online, and we really want to continue this online sessions because it is so much easier for a lot of us to connect even though we are very far off physically. And we started these online sessions when we were hit with COVID, and we are continuing with that online session once a month. We come up with various topics, and today is one of them. ARDSI Calcutta is basically an organization that cares and supports for people living with dementia, and also their caregivers who care for their loved ones. We have various programs from awareness to memory screening to caregiver support meets. We have a daycare center where people living with dementia come and spend their day. We have home companionship program, and we have various publications to help guide people who are caring for their loved ones every moment. So that's a bit of introduction from our side. Thank you all for joining. I think this is a very important session, and I will not spend a lot of time talking myself, but the moment this session was thought of, and I wanted to bring the area of music, how music as an expression helps people living with dementia. It gives us all a beautiful time, but for people living with dementia, how is it different, or how does it really enriches their life? So that's the topic today. But before before Arijit starts his presentation today, I just could not stop myself from just sharing a personal thought, I would say, with all of you, which is when we think of how music connects us with our past, how it helps us to evoke memories. One song that comes to my mind, a very personal song for myself, which is Dil Kya Kare Jab Kisi Se Kisi Ko Pyar Ho Jaye, Jaane Kahan Kab Kisi Ko Kisi Se Pyar Ho Jaye. Now this song, even after I have passed 50, when I sing this song, it brings back a lot of beautiful, very strong emotions. And it reminds me of my school days when I was a teen. So I believe that music do evoke strong memories. And I think when we talk about music and dementia, which is the topic of presentation today, we know that research has proved that music is a unique stimulus for reaffirming the personhood, the connectedness of person living with dementia. So for more information on how music as one of the most significant artistic expression plays a role in caring for those living with dementia, I will hand it over to Arijit today, who will share his experiences, his understanding, his passion. In one line, if I have to introduce Arijit, He is a person who is passionate about music, cognitive science, brain health. So, all of you, once again, thank you for joining. And here is Arijit Bhattacharya for you. He will do the rest of the session. Thank you so much. Thank you.
Thank you, ma'am, for this warm introduction and wonderful introduction to the topic. So I hope I'm clearly audible.
Yes, you are.
Okay, so let me start today's presentation. Very good afternoon to everyone present over here. So I'm going to share my slides. I hope it's visible.
Yes.
It's visible, right?
Yes.
Okay. So a little bit introduction about myself. So I'm Arijit Bhattacharya from West Bengal. I'm in the final year of my BTech MTech dual degree in biotechnology, student of KIIT University Bhubaneswar. Currently pursuing my master's dissertation thesis from National Institute of Mental Health and Neuroscience from the Department of Neurology, Bangalore. And I have done a music therapy certification from the centerofexcellence.com on 2020, and recently I have got affiliated as a registered music and memory administrator from Music and Memory Organization USA. So and apart from the academics, I am also a sitar player, learning for the last 15 years from my Guruji, Pandit Urbain Chatterjee. So after my talk, I'd love to play some raga and music for you all, and I hope it will be interactive. So these are the topics I'm going to cover today. Keeping in mind for all kind of audience, I'm just keeping the presentation very simple. And if someone has some doubt, then please let me know. So most of the people present over here know what dementia is, but still, as a matter of fact, so dementia is not a single disease. It's an umbrella term. It's a syndrome that can cause a number of diseases, which can cause nerve cell damage and brain degeneration, and which leads to deterioration in the cognitive functioning. Dementia consists of many diseases. The most common type of dementia is Alzheimer's diseases, and coming in row, vascular dementia, Lewy body dementia, frontotemporal dementia, as well as mixed dementia. The number of people with dementia is increasing highly. According to WHO, worldwide almost 55 million people have dementia, and they have predicted the number will get doubled by 2050, which is really a matter of concern for the present world. So considering dementia, considering the treatment options, there are mainly two types of treatment people, right? One is a pharmacological treatment option, and the other is a non-pharmacological treatment option. So the pharmacological treatment option involves drugs and medications, but it depends upon the finding and symptoms, as there is no such particular drug for any kind of dementia. Clinicians need to screen the persons based on their symptoms and finding the drugs. Whereas the non-pharmacological treatment option has reminiscence therapy, physical therapy, CBT, cognitive behavioral therapy, CST, cognitive stimulation therapy, music therapy, dance therapy, movement therapy, a lot. So in the right side, you can see a picture of a booklet, which currently I'm working in National Institute of Mental Health and Neuroscience. It's called as a cognitive stimulation therapy, very popular in outside India, especially in UK, which helps in improving the cognition for a patient with mild cognitive impairment and dementia. But our today's discussion will be more focusing on music's effect on dementia and brain. So music is an integral part of our life. I can ask you if you can tell me about a day without music. I don't think it's going to be that easy, because almost then and now we used to listen to music from our early childhood, starting from the lullaby to movies, everywhere. And melody you can find everywhere, starting from nature to YouTube, to the modern audible devices like iPod, music helps in many things, starting from attention, concentration, learning, movement and coordination, quality of life, happiness. And it can activate almost all the brain part, as music have a lot of components including pitch, rhythm, melody, language, emotions, timbre, a lot. So there is no specific part in our brain which is particularly responsible for music. Music pathway, of course, can start from the basic auditory pathway from our ear and later on move to our brain. And it involves both the hemisphere, although it's believed that right hemisphere is more involved in music rather than left hemisphere. So this is a picture of a brain where which part of the brains are involved in music. So we have corpus callosum, which actually connect both the sides of the brain, which create an interhemispheric coordination between our brain functionality. So the language portions are mainly present in our left hemisphere, and as I said, it's believed that the melodic part is present in the right hemisphere. This corpus callosum connects the interhemispheric connection, and it exchanges the language part with the melodic part when we sing. Then comes the motor cortex, which involve in movement. You might have noticed while listening to a music, we vibe with it, we move our body, we clap with our hand, our body is to change, and that's the part played by motor cortex. There's a prefrontal cortex, which is one of the most critical part when it comes to music cognition, as it controls the behavior, expression, and the decision making, like which music you want to listen, which is your favorite, which music you don't like. We really don't like all kind of music. We all have a preference towards music. So yeah, that's where the prefrontal cortex plays its part. Then amygdala. And so what amygdala do? Amygdala is considered the emotional part of our brain. So we all have an emotional attachment with music. At least most of us have an emotional attachment towards music. When we listen to sad songs, our facial expression and mood changes. And when we listen to our happy songs, we feel like dancing, vibing with it. And that's where amygdala is influencing us to do so. There is a sensory cortex. Sensory cortex controls the feedback while playing an instrument or dancing, that yes, you have to play this note now. This is Sa, so now you have to play Re. So it's like that. This is where the sensory cortex plays its part. The most important part is auditory cortex, because when we undergo a musical training, the first part we have to learn is ear training or training to listening. So one good musician or a good music lover need to be a good listener. And this listening task is played by auditory cortex. Then there comes hippocampus, which is involved in our memory. We all have a musical memory, like from our early childhood, the lullaby we used to listen to sleep, to our teenagehood, college life. Every part have a specific musical preference. It keeps changing also. And this is where hippocampus helps us in memorizing them. The visual cortex. So you might have noticed we also listen to music by closing our eyes, and we can imagine a dream scenario in our mind, and this is where the visual cortex plays its part. We can dream also, musical dream. Yeah. And then comes cerebellum, which is while dancing or playing, it helps us controlling our emotional reaction. So not only in case of a listening task, but when singing also, emotion plays a very crucial role. If you don't sing or play from heart, it won't sound like a peaceful or soothing thing. So to do that, cerebellum helps us to connect with our emotion as well as music. Now moving forward, there are some benefit of music. So I have kept as a point, I'll explain. The number one is regulation of agitation, anxiety. So how it helps in agitation and anxiety. So music has an impact on our positive memory. and it also have an impact on our neurotransmitters. There are certain types of neurotransmitters which get activated when we listen to music, when we are happy, such as dopamine, serotonin, and music stimulate those parts to secrete and stimulate dopaminergic secretion and serotonin secretion, which helps us managing our anxiety. It helps us to manage our agitation as well, as it makes us, it triggers our positive memory, positive emotion to keep us engaged. Music can distract our mind from anything and everything, and this is how it can help us in pain management. And again, dopamine is a very important thing. We can't think a day without it. Dopamine helps in pain management as well. So when music comes to our brain, it tells the dopaminergic cell, now go and secrete. And that's when dopamine comes, which gives us a pleasure, and we can distract our mind from the pain region. This will really help in a pain management. For sleep improvement, this is a part which is known to most of us. As I mentioned from the beginning, there is a sleep song in our playlist every time. From the early childhood, our mothers used to sing a song to, make us sleep. And till now, at least I have a specific song to sleep, though it keeps changing. And I guess most of you have those kind of songs to get a good sleep or to start your sleep, right? So yeah, then comes mood and depression. So depression is a clinical condition. We sometimes mistook it. One shouldn't ignore the clinical symptoms of a depression. But yeah, coming to the therapeutic treatment option for depression, music is an integral part of it. Again, music triggers dopamine and serotonin, which helps in raising our positive mood. And the other way, it is believed that music can reduce the secretion of cortisol, which is a neurotransmitter or a hormone responsible for stress, anxiety, and depression. Coming to speech therapy have a very integrative application in dementia, which is known as MIT, or melodic intonation therapy. But melodic intonation therapy too. So if I give you example, if you remember learning ABCD, we haven't learned ABCD like ABCD, EFG. No, we have learned it like ABCD, EFG. Remember? So yeah, so this is how we learned it, and we just learned it by adding a cup of melody into the language. And this is what the speech therapist do while doing a speech therapy for the person with Wernicke's aphasia and Broca's aphasia. The research is going on dementia and aphasia coordination for melodic intonation therapy. So this is a wonderful example of music therapy in speech therapy. Then physical therapy, yeah. So there is a particular field in music therapy called as music and movement therapy. What we do, we ask the patient to coordinate their hand and leg movement while listening to a music. It's called as a musical task. So at least a lot of music have a rhythm, a beat. But we ask to start with a hand clapping. So when we clap with our hand, our brain and the auditory cortex need to be very attentive to listen when the beat is coming. What is the time gap between two beats so that it can place the clapping in between that. And then we slowly ask the patient to tap somewhere, and then hand and leg tapping together, and a cross tapping like right hand, left leg, left hand, right leg, two hands, no leg, on the leg, no hands. So this is a part of music therapy with physical therapy, what we do. So yeah. Now music therapy has been going on for years, specifically in India, in Indian classical music aspect. Now a little bit introduction about Indian classical music. Indian classical music is majorly divided into two parts. One is Hindustani classical music, which is mostly performed by the northern part of India, and the other is Carnatic classical music, which is mostly performed by the southern part of India. Although both expresses the same thing, some ragas are also same, but the expression of the music is very different in both the forms of Indian classical music. There are many styles in Indian classical music, starting from representation of a raga by alap, jod and jhala, to playing tal, thumri, khayal, bhajan, folk, Sufi, ghazal, etc., etc. Representation of Indian music is mostly done on two ways. One is vocal and the other part is instrumental. So in vocal there is a khyal, bhajan, we are used to listen to this. And in instrumental music, we mostly focuses on raga expression, representation, thumri. There are some percussion instruments like tabla, mridangam, ghatam, which focuses on tal. Although they are related to each other, without tal, instrumental or a vocal music can't live. So yeah, the most interesting part about Indian classical music is each raga have a specific dedicated time zone. For example, we only play Vairab at the very early morning, and we play Yaman or Yimon at the evening time. So this specific time zone is found to be very effective in terms of listening as well as playing. I will come to that later. So yeah, there is a picture I've added of all the legendary Indian classical musicians. Although many are left, but yeah, covers many people, starting from Pandit Ravi Shankar to Ustad Zakir Hussain to Ustad Amjad Ali Khan. So yeah, moving forward. Now, I've explained you what is the benefit or the effect of Indian classical music, how it helps. But yeah, so Indian classical music have specific some effect which is not there in any other form of music. The number one part is mood improvement. As I mentioned, that the specific time zone is there in Indian classical music. So this time zone, like if I listen to Yaman in the early morning, may not give the same effect if I listen to it in the evening. So this specific time zone, if we follow, the effect of that music is thought to be increases, and it can help in time relationship understanding. So to all the caregivers, you can follow one thing. You can write down the specific time for a raga, for example, morning 4 to 5 for Raga Vairab, and play this for 1 or 2 weeks, a same composition for the patient, and then gradually asking them what is the time when we play Vairab. This is the part when they will understand that this music I listen every day in the morning. So I have to tell this particular timing. You can, like similarly, you can play Rag Yaman in the evening, Rag Bihag in the late evening, like that, Rag Bhim Palasi in the afternoon, and you can ask them that what is the time now. This really helps in time relationship understanding. There is a part of critical thinking also comes, as they have to really understand that this is the music of morning. So they have to understand that Ya Jago Mohan Pyare is in Rag Bhairab, can't be played or it can't be sung in the evening. I have to listen to this in the morning only. So that's a part. Then comes the happiness and emotional well-being. I think many of you know about Ustad Zakir Hussain's tabla playing. If you see him while playing, he becomes, he goes at the top of the world. So this happiness, so even if someone who is performing, is that much of happy, this will definitely create a smile on our face. This is how music can create happiness and emotional well-being. It can help in concentration, as it will not happen in 1 day or 2 days like a magic. It will take time, but initially after 1 or 2 days, the music can help. As Indian classical music is always start with the alap, and alap is a part where it is the introduction of a raga. By listening to alap, one can understand which raga I'm going to play, and to know that they have to listen for a few days or a few weeks to train the ear that yes, this introduction is for this raga. Yeah, so here is some music-based setup which you can follow in your home. So listening to favorite music when feeling low, that's a part which we do, I believe. Then a part is maintaining a music diary. So keep a separate diary, writing, yes, I have listened to this and this song today. Write about your feeling, how you felt, and what is your thinking about this music. At least one line will help. So yeah, if even if the patient can't write, so this is a part where caregiver can help. They can ask and they can write on behalf of them. So this musical diary really helps, and it will help in keeping a track, as I mentioned, the time relationship coordination, where you can write that yes, I have listened to Raga Bhairav at 6 a.m. So keeping the track of this for 1 week, and after 1 week you can ask the patient that what is the raga or the name of the raga we played at morning 6. They can definitely refer to the diary for a few days, and after a certain time you can see the difference. They'll start remembering those things. Then learning some musical instrument also help. I'll not ask to become a maestro all of a sudden, but yeah, even if you start learning, it will involve the very critical thinking of our brain, which helps in the social engaging as well. So some basic musical training will also help. So for example, like learning singing, or even piano, harmonium, even tabla. So this kind of instruments can be learned, and do it with a proper training. Then keeping rhythm with music is a part which I just explained, that you have to ask the patient to clap with the music with both the hands, then tap with leg with the rhythm, then right hand, left leg, left hand, right leg, both the hands, no leg, both the leg, no hands. So this is a part where the motor coordination, critical thinking, understanding, all will come together. Playing musical games is something which is a very engaging thing, starting from Antakshari, sing along, to passing the ball, where we can sit in a circle with a chair. You can get a sponge ball and then play a music and stop the music after a few rotations, and then ask the person, whoever holds the ball, to perform something, sing something, say something, anything. But do remember to not to do it only clockwise. You have to do it anti-clockwise as well. So for example, do 4 rounds in clockwise and then 4 rounds anti-clockwise, so that the patient will understand from which direction the ball will come next. So then there is musical chair. That is another game which we used to play from early childhood. This is a fun game, engaging game, but while playing musical chair, you have to be very conscious of the fall risk. So that's the thing. And then spend some time in nature. We really enjoy listening to the sound of birds, although nowadays it's very rare. So, but I believe in the early morning, if you can go to a park or even an empty road, you can definitely listen to a bird. And again, keep your music diary with you and write down which bird's sound you have listened today and what you have listened tomorrow. It can be also sound of pond, water, trees, anything. Just spend some time in nature. You can see the difference after 4 to 5 days. And keep a track so that you can notice the changes afterwards and you can refer to them as a memory. Then watching music videos, as I mentioned, that watching someone engaging or enjoying the piece will keep a smile on our face. So definitely watching music videos help in that way. There is a task called assigning music for photos. So here what you have to do, I believe that most of us have a photo album in our house. So even if you don't have, it doesn't matter, you can click picture now also. So what you have to do, you have to keep some photos in a table and ask the person to dedicate one song to that photo. It can be whatever song comes to their mind first after seeing the photo, or it can be a music or a song related to the scenario or the situation of the photo or the person of the in the photo. Can be anything. Assign them, write it in the music diary, or you can write it in the back of the photograph as well. So do that, and after again, like suppose you're doing this in the morning, repeat the task in the evening so that person will remember it. There should be a practice effect in that they should remember the thing in the evening. Religious music and chanting, some of us really enjoy that. That also helps. Doing some chanting or listening to religious music or even singing it, because this is a part where a lot of people can connect through their soul. So this is a part you can do. Connecting to that, meditation, like a lot of people find difficulty in doing meditation, including me. So yeah, what I do, I play a music to meditate. It can be soothing flute of Pandit Hari Prasad Chaurasia, or it can be a Mozart as well. It can be anything, and it can be very early morning in the roof while listening to the sound of the birds, concentrating and meditating. I believe that can make a very huge difference. So yeah, those tasks you can of course do, but there are some specific measurements which we need to take. So the number one is to make sure to maintain a comfortable sound level of the volume, because very high volume can be very disturbing and a very low volume can be very annoying. So you have to be very sure about the volume which you are keeping while listening to this. And use earphone or headphone while listening to a music. But yeah, if a person have a auditory equipment, then it's better to skip that. Right now, some auditory devices have a Bluetooth also, so you can directly connect and listen to music in that. Then yeah, if you are using a earphone or headphone, maintaining a hygiene is very important, as you are using a earphone or headphone used by someone else. It may not be that much hygienic, so make sure to clean it. Right now, because of COVID, I believe all of us have sanitizer in our home, so we can just clean the earphone and headphone to avoid any kind of anti-hygiene effect. And so yeah, the next part comes is making sure that we should keep a break between continuous listening. This one came from one of my experience, where a patient of dementia, she has frontotemporal dementia, and she really likes listening to music. But what happened, she has developed a musical obsession. So she needs music, and that has turned into obsession, which is not good again. So to avoid that, so this is the part when the diary helps again. That yeah, today I have listened to music for 1 hour in the morning. I can do it after 2 hours or after 3 hours, not continuously. When continuously listening is also bad for your ear. So to make sure, give a break between continuous listening. And yeah, do not force to listen, because the song you like may not be the song I like, or may not be the song the patient or the person with dementia like. So make sure you shouldn't force someone to listen. Ask them what they like, or you can just play and you can see by the facial expression that yeah, this is a song which person is liking, and this is a song which is don't like by the person. So you can get a track about it from them. Be very conscious about the falling risk while playing the musical games, whether it's musical chair or the passing the ball. Passing the ball, while playing passing the ball, make sure to get a very soft sponge ball. You can get a sponge football like ball from the market, which is believed to be non-harmful. So get those kind of ball. Do not play with a tennis ball or a cricket ball. That can be very dangerous. And so be very serious about fall risk while playing musical chair, there should be someone who can pay attentive to the person. And the next point I mentioned about this obsession thing, keep a time gap. And yeah, you can always consult a music therapist for a better experience. There is a lot to add for individual people. Cannot be done for common for everyone. There is an individual preference for music, so you can definitely ask music therapist closer to you for a better experience. And you have to remember that anything and everything which has a positive effect or impact have negative impact too. There are a lot of distress that can be happen because of music as well. So do not ignore or avoid them. Consult the clinician immediately if you see any kind of unusual changes. I can give some example. For example, if someone develops some convulsion or seizure after listening to music or a particular music, do not avoid it. Please go to a doctor or a clinician, get it diagnosed, what is happening properly. If there is no involvement in music because of that, it's fine. Otherwise, do check that. If there is some distress happening in the ear, some auditory problem is happening because of very high listening, do contact your clinician. If you can feel that obsession is developing, then again you have to contact the clinician. These are the few things you have to remember. I know we listen to music every day, every time, but as I said, it can have some negative impact. So if you see some unusual changes, to contact. So yeah, now I'm going to show a video of music and memory organization from USA called as Healing with Harmony. And yeah, I hope you will enjoy. Is the video visible?
Yes, I think, yeah.
Can you hear it?
Yes.
Okay.
Music is really a wonderful vehicle that helps us get in touch with that person's humanity. If a resident had a diagnosis of dementia, the probability of use of an antipsychotic medication was very high.
Everyday physical altercation, it ends up in fight and it ends up in force.
HHC precipitated this availability of iPods. That really started to coalesce a lot of creative endeavors in how to add humanity in the care of dementia residents who live in a nursing home. Dementia is not an identity, it is a diagnosis, and people still continue to be the people that they are.
See them responding by moving their heads or tapping their feet, and if you walk up to them to say, "You like it?" they go by the nod of a yes.
We were able to program many of the iPods with music that was specific to the needs of individual residents.
If I can give them a mix of music that they want, it just makes them that much happier, and it makes them that much easier to get along with. So like I say, sometimes if you're not going through what the resident is going through, you won't really understand it. But if you could relate to them through music, it's one of the best things in the world.
Abuela, música, 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 sí, música, música,
Place of music in everyone's life is so unique because it begins to blend in with our emotional memories.
having music and memory, and we have the ability to just bring back that person sometimes for a moment and sometimes for a day, it's worth more than 1,000 words.
Music and memory has impacted with the staff as well by reducing a lot of the stress that we hitherto had suffered by trying to make these residents comfortable.
Anybody who has brain is at risk for dementia. So I always tell my staff, and I always think that see ourselves in our residents. So when we have passion for the residents, we do that.
Music and memory works because it's a wonderful way to individualize, recognizing who this person is, recognizing his or her personality, and really through music bringing out what that person's being in touch with their own life.
So yeah, I hope you all enjoyed watching the video. So yeah, so the next, moving forward, when it comes to music, dementia, or music into neuroscience, the first name comes is Dr. Oliver Sacks. So yeah, here are some books on music's effect on brain. As I mentioned, the first name comes to our mind is Dr. Oliver Sacks. He was a neurologist from the UK who had changed this world with his musical perception, his contribution by writing this book called Musicophilia, where he has documented a lot of case studies done by Dr. Concetta M. Tomaino from USA, that what kind of changes he has seen in the patient with different neurological condition after giving them particular type of music or doing music therapy. So if any of you are interested in reading about music's effect on brain and neurological conditions, do read this book. Trust me, you can't stop yourself from reading the other books written by this person. Yeah, so the next book comes is Music and Dementia, From Cognition to Therapy by Dr. Amy Bird, the main author of the book. This book suggests what can be done for the people with dementia in terms of musical therapy, what can be done with mild cognitive impairment and music, how to involve musical activities in our day-to-day life. The next book comes is This Is Your Brain on Music by Dr. Daniel Levitin. This is a book which explains what is happening inside our brain when you listen to our music. The next book is The World in 6 Songs, again by Dr. Daniel Levitin. This book explains that music have no language. So the world can be connected by a single thing, that is melody, divided into 6 components of music. The next book is by Dr. Anirudh T. Patel called Music, Language and the Brain, which explains the interhemispheric coordination of musical melody and language, involving both left and right hemisphere and the language portion. So yeah, coming to a conclusion, music is a non-pharmacological approach which can not only help in memory but can also help in improving the cognition. And yeah, this current world of neuromusicology is growing very fast, and I hope that it will become one of the frontline treatment options for dementia very soon. These are the references which I have used for my talk and this presentation. And yeah, I'd like to thank a very few people and organizations for helping me in gaining knowledge and experience in this field. My supervisor in NIMHANS, Dr. Suvarna Ladi, my Guruji, Mr. Pandit Purvain Chatterjee, Dr. Fahim Asad, Dr. Sandeep Kumar, Dr. Concetta M. Tomaino, Dr. Isabel Puratz, who discovered the disease amusia, Dr. T.V. Sairam from Indian Music Therapy Association, Music and Memory Organization USA, Center of Excellence, Of course, Dr. Oliver Sacks Foundation for giving me the permission to use the video that I've shown. And yeah, most importantly, Nilanjana ma'am and ARDSI Calcutta for inviting me for this Caregivers meet. Yeah, thank you. I hope you enjoyed the talk.
Thank you. Thank you, Arijit, for this very, very insightful and very important points that you have shared. I think when we think of music and dementia, we feel that it should be just music that somebody should hear. Music could be tied up with so many different things in our lives, and it need not be just listening to music when you have nothing else to do. You could be eating and listening to music. You could be in the garden and have the music play at the background. I think just as you say that music is an integral part of our lives, literally we have to do that in people with dementia, because the more verbal language we use in communication, it creates more issues with people with dementia. I think music there can replace the verbal communication that we humans use. And I think one of your slides particularly interested me, where you mentioned about the various musical games that one could bring in. So I think that was wonderful. And if there are any questions, please. Or is there something that you would like to end with and then take questions, Arijit?
Yeah, sure, that would be great. I can play,
Yes.
or if someone have question, meantime they can think also. I guess Dr. Subhrangshu want to ask something. Yeah, please, sir.
First of all, I enjoyed this talk very much. It was really wonderful and very much enriching. Thank you. I have one curiosity.
Yeah.
I liked this presentation very much, because you have mentioned so many complex things in such a lucid and easy to understand language. Wonderful. I have one curiosity, whether mood congruent music is better or mood incongruent music is better. Let me explain. Suppose I am in a sad state. May not be clinical depression, just in a low mood state. Now is a sad music, like sad composition, is better for me, or a joyful composition would be better for me at that moment? And I have another question. There are several apps available in Google Play Store which can be freely downloaded and used. I personally use one which is quite handy, but what it does, it has one artificial intelligence algorithm embedded in it. It keeps track of the kind of music I listen. Even it keeps track which music I listen full length and which I midway click to another one. And then what happens? It keeps suggesting me. And is it better to rely on their suggestion or to explore beyond that? Which would you recommend?
Okay. Yeah, so I'll take the first question first. So the first question about listening to sad music in a sad mood state or a joyful music in a sad mood state, which helps. So yeah, it really depends upon the person, again, depending upon the mood. But what I feel, I have read some few literature from Harvard has said that listening to sad music in a sad mood state really helps us, as at that moment we feel like we're really alone. We don't have anyone to share those things, and that is when we can relate with those sad music, because that music has the same environment that I am experiencing currently. So I can relate with them, And slowly, if you have experienced those states, we can just change our track from a sad to a moderate sad, and then listening to a joyful music. If I just listen to a joyful music at that moment, it might not be that much of effective. I might feel that no, it's not giving me any changes. But yeah, listening to sad music can give me a feel that I can relate with the music, which can give me time to understand myself and as well as to change my mood. And coming to the second question, I'll definitely suggest to explore more. Even nowadays, like all the musical apps, like many musical have this recommendation thing, which is really good, because sometimes the recommendation comes like, I was just thinking about this song and this app have recommended me that song only. But until and unless we explore, we will be bounded in their recommendation only. There are a lot to explore. So it's really good to keep the mind open while listening to this. Like, I really like Indian classical music, but I listen to every genre of music to explore, because until and unless I explore, I'll never know that whether it has some of my interest or not. So yeah, I hope that answers.
Thank you so much. Actually, I myself keep shifting from one playlist to another in that app. So I had seriously this query whether I am healthy or not.
No, of course. You can keep shifting and you can explore them. You can explore different type of music, because there are a lot of unexplored music in Indian music as well as Western music, which can really give you a definite joy.
Thank you so much. Very nicely explained.
Thank you, sir. Anyone else?
I don't see any questions on the chat box. If there is anybody who would like to put in a question, you can put in the chat box and we can take the questions from there. Otherwise, you can unmute yourself and ask questions to Arijit. And I think there's so many areas to explore in the music world. So,
true.
True. Just as you were discussing this exploring various types and various kinds of music, I just remember a gentleman who used to come to our daycare center many years back. He was into Indian classical music, and his family clearly mentioned that all he loved was Indian classical music. So we would spend a lot of time presenting Indian classical music to him. Gyan Prakash Ghosher Chhatro Chilen. So a lot of variety, but the basis was Indian classical. So one day there was some issue with the player, and we didn't know what to do. So the staff who was assigned with him just started playing Nat King Cole. And the few of them who rushed and said, why are you playing this song? He has never been exposed to Western classical or Western type of music. He is not going to enjoy. But what we saw was that he was listening to Nat King Cole very quietly, and he asked it to be played again and again. And so what we started doing was, from that day onwards, we kept playing, Nat King Cole, that particular song. And after a certain time, we said, can you sing along? And what we saw was that he couldn't pick up the lyrics, but the tune was just perfect. Now, someone not even exposed to Western classical or Western music was able to pick on, because it's just the emotion, the feelings that is attached to that tune. Especially, I still remember him smiling and saying, oh, he just said darling. And that kind of, evoked a lot of memories in him. So I think, music has no limit to what it can do to anyone, irrespective of whether one has dementia or any other condition. So it's just wonderful. Yeah.
Yeah.
Yes. Yes.
Ma'am, I have got a question in chat box as well. Priyamvada, she have written that is there any long-term negative effect of listening to sad songs? Not sure about this, but I don't think there is some effect until unless you like listening to the sad songs. Really depends upon what is the thing you like. Just like someone listening to metal for a long time, other people can think that there could be a bad effect of that, as there is a lot of noises and distortion. But no, if the person enjoys that, if this is of the person's interest, I feel like it's completely fine. Yeah, but you have to be very serious about the sound and the volume.
True. And I also feel that even if a song, whether it's sad or happy or if it evokes any kind of memories, sometimes, as we mentioned, negative, in the sense that that person is being restless listening to the music, or is not trying to leave the room. Those are the kind of signs that we have to be very particular about. But I again remember another incident in our daycare center where this gentleman was listening to Muhammad Rafi. For him it was his favorite singer, and so one particular song, Parda Hai Parda, and we started playing the song, and after a certain time he started crying. And when I say crying, he was really, really crying, and everybody was really, staff said, "Ma'am, we have to stop." And I said, no, let him, just relieve his whatever feelings he's having. And later on, when I talked to his wife, she mentioned that this particular song basically was his favorite, and he enjoyed listening with his wife. And I think before they were married, that was the movie they had gone to, and probably it was bringing back those memories. You never know. So crying again it's just a very normal emotion, and you just have to be there, hold hands, support, and as Arijit, you mentioned that it is the clues that we have to look for: restlessness, agitation, any physical changes, facial expression change. All these things I think is very important as caregivers to take note of.
Yeah,
exactly. Questions for you there.
So I guess Jyoti Sethi, he raised hand from a long time. Yeah.
Hi, Arijit.
Hello.
I think it was a wonderful presentation, and I'm a caregiver for my husband.
Yeah.
Is there a particular time that one should be looking at doing the music part of it? And I'll tell you why I'm asking this question is that if we were to play a particular music in the evening, he would be happy, he would dance, he would do things like that. But the same effect does not come, say, if it is during the before noon or something like that. So is there a time that the effect is better?
Again, it depends upon, there can be the time related to the particular type of music, but you can try different type of music rather than choosing the same music in a different time. You can try choosing a different music, maybe for the afternoon and for the morning, like that, because he has a special place and timing in his brain for that specific music. Let's not disturb that part. Let us try finding another music which can get a place in that time. So I guess that can help.
So if we're saying is that if a particular music there is no reaction, are we in any way confusing the situation? That's why there is nothing and he's just staring at the thing? Would you say that?
No, I can't really say that. It can be a prediction just, but it cannot be a documented effect like that. You can try with some, so what you can do, you can try finding some music from his favorite playlist or something, and you can try playing them in a different timing to check what is happening in a different timing, what is the facial expression, how is he reacting to that music. And I guess this is how you can find a timing and music coordination.
Okay, thank you. Thank you. I'll try that. Let me see.
Yeah,
Thank you.
definitely.
Thank you.
I guess Dr. Selva sir have written, what is the role of music in prevention of cognitive impairment? And to what extent music can be used for the intervention of dementia? So yeah, coming to the first question. So music, studies have found that music can create a structural changes even in our brain. There's a portion called omega portion in our brain, which has found to be bigger in the person who plays piano. So when we are involving, so for example, in dementia, what we have seen, so the first cognitive skill we lose is the cognitive skill we do not use very frequently. So if we are involved into music, like for example, every day or at least majority part of the time, then this is an integral part of our life. Then it will be the last thing to lose in case of dementia, which can really help in cognitive impairment, as well as like learning music helps critical thinking, coordination, attention, which is a very important parameter for prevention of cognitive impairment. And coming to the second question, to what extent music can be used under intervention for dementia? So music therapy, and so there's a program called music medicine, which is approved in USA only. What they do, they have done surgeries also. If you might have seen a video got popular when a brain surgery was performing and the person was playing saxophone and violin. This is just because we do not have pain receptor in our brain, so the surgery can be done by giving local anesthesia. And the doctors did the surgery because the person said, I don't want to lose my violin skill. So he just asked him to play and then did. So this is a part where our brain like involved with music. So I think we can use music at any stage of dementia. I will definitely suggest to watch a video called Alive Inside. It's available in YouTube. It's by Dr. Oliver Sacks himself. It's a story of Henry, who has frontotemporal dementia, and he was a 92-year-old person who can't even recognize his daughter, but he remembers his childhood music. He is always, he used to stare downwards. He don't like talking to people, don't do eye contacts. But when Dr. Oliver Sacks gave him his favorite music by doing a screening from his daughter, he started talking to the people. So he has even given explanation that what music does to him. Even at one key study, Dr. Oliver Sacks has said that a person who was a Mozart lover, Oliver Sacks asked him that how much you like the music and what kind of changes music have made. And he gave one answer that it all comes from heaven, which is a dialogue from Mozart himself. So this is the kind of changes which people see. So I think this will help. Yeah, the next question, if someone is not good at music, would music therapy be beneficial? Yeah, definitely. You don't have to be a maestro to get a music therapy. It's just like a speech therapy or something. It's just like a therapy. So even we listen to music. So no one has a musical training by born, but we listen to music from early childhood. Right? So there is no such barrier. You need to know music to get a therapy or to get the benefit. There is no such concept. The next concept about next question is the so name of the movie is Live Inside. I'll probably write. It's freely available in YouTube. You can see. So yeah.